Why do I recommend NoSnoringMoreAir to my patients? The reason is simple. Almost 80% of all snoring and apnea is the result of too small a nose entrance. This is an important fact, often overlooked. Let me explain. In the course of the years, the muscles of the nose weaken, especially those of the nostrils. They become too weak to keep the nose open during sleep. So we start to lack air when we sleep on our side. Because the lungs continue to inhale, an under pressure occurs and the airway becomes even narrower. In order to get more air, we turn on our back, but in that position our tongue and uvula fall back in our throat and block the airway almost completely. The air accelerates and makes the tissue at the back of our throat vibrate. This makes a sound called snoring. Please realize that this whole process starts with too small a nose entrance and that NoSnoringMoreAir keeps the nose entrance open. Therefore, this product, NoSnoringMoreAir, is the best and most effective solution against snoring and apnea, as it allows more air into the system, much like the PPC treatment in sleeping clinics. The material is soft, flexible, and adapts easily to the shape of the individual nose. The tube is medical and is unique. It is often used during operations in hospitals, and therefore it causes no irritation whatsoever. It is practically invisible. To conclude, before trying any other product, my advice is to try NoSnoringMoreAir. It stops snoring and apnea in almost all cases.